Hi, my name is Rachel Tucker. I'm a family nurse practitioner student at ETSU, and I'm going to talk with you about PCOS and some alternative ways that it can be treated. So first of all, polycystic ovarian syndrome, PCOS, is incurable and quite a daunting sort of diagnosis to get, and most of what you do is manage the symptoms for the rest of your life, but you can help create an environment that will be helpful for healing in your body, and that way it will be much more functional in life to go on with PCOS. So there are three criteria that we look for: heavy periods, no periods, that's one; excess testosterone, and cysts on the ovaries. We want you to have two of those. If you're wanting to look at your testosterone, we need a serum blood level, so they're going to have to take your blood. And then cysts on the ovaries, we need to see that through an ultrasound. If you haven't done that yet and you think you might have PCOS, we're looking at some symptoms here. Again, irregular heavy periods, cysts on the ovaries, which again, we don't know yet, and excess testosterone, also need a blood test. But infertility, obesity, being overweight, hair growth on the face, chest, groin, places where men would normally have that, acne, darkening of the skin around the neck or armpits, and thickening of the skin as well, hair loss, insulin resistance and diabetes, all of those can be underneath the umbrella of PCOS. Not everybody with PCOS has all of these symptoms. I've seen many women with PCOS have babies, and I've seen and others who can't get pregnant, and then I've seen many who are super overweight and others who are underweight. So you have to be able to look at your blood levels. So if you suspect PCOS, talk with your provider. The biggest thing, if you do have PCOS, dietary and lifestyle modification. You want to decrease the glucose in your blood because of insulin resistance. Insulin resistance leads to testosterone production from the ovaries. So if you lower the glucose in the blood, you can help lower the testosterone and therefore the symptomatic effect of PCOS. So biggest thing is to decrease your carbohydrate intake. So that means no refined flours or sugars in the form of cookies. I know. It doesn't mean you can't ever have them, but definitely decrease that. And use fruits, vegetables, things like that you can eat. Nuts, seeds, increase protein intake. A big thing that a lot of conventional practitioners will use is metformin. That will decrease your glucose and increase insulin sensitivity. But some people are against medication, and as practitioners we want to be ready for that. So we have a supplement called berberine, which is actually a chemical that's found in plants and herbs that lowers the glucose in the blood levels and increases insulin sensitivity, comparable to that of metformin. And a lot of patients who have used it, studies have shown, don't have the side effects that a lot of patients who are on metformin complain of. So if we're increasing insulin resistance, it also has an effect on the cardiovascular system. A lot of patients with PCOS have increased triglycerides or cholesterol levels. So omega-3 fatty acids are a wonderful thing. And again, you can get that through diet. You can get it through fish. You can get it through nuts and seeds. But a lot of that, of course, supplementation will be good. We want to lower testosterone in the blood. We want to increase progesterone. Spearmint tea is a big thing that will lower testosterone. Marjoram tea will actually decrease DHEA, which is a precursor to testosterone. Therefore, if you lower DHEA, you lower testosterone. Chamomile also can recover the cystic ovarian tissue, which can increase progesterone, decrease testosterone, but it also has antispasmodic properties. So for those of you who have really painful periods, drink chamomile tea and it can help with that pain. Those of you who are having issues with fertility, there's a supplement called myoinositol, which is a component of the cell membrane in fruits, beans, nuts, and seeds. And studies have shown that patients who supplement also with folic acid restored ovulation in 70% of the patients and decreased testosterone and increased progesterone. Of course, with ovulation that will happen. Another thing, exercise, particularly holistic yoga. So the studies have shown that holistic yoga, which is not just the postures and the poses, it's also relaxation techniques, it's medication, but it also comes with counseling sessions on lifestyle and stress management. And patients who are doing that will decrease testosterone and increase their menstrual regularity and frequency more so than just regular exercise. There has to be lifestyle modification, all in all. No matter the route, you cannot out-supplement or out-medicate a bad diet if you want to give an environment in the body for healing. So practitioners, we've got to be ready, and we want to answer your questions and know how best to use both models to see which one is best for you. Maybe we use metformin in one case and also omega-3 fatty acids and yoga, and then the next we use berberine and some oral contraceptives. It just depends upon our patient. It depends upon how we can best help you. So ask questions for us. Thank you.